In lumpectomy, the goal is to remove the breast tumor with a margin of clear tissue around it. That's the bottom line. So when we do these needle biopsies, at the conclusion of the needle biopsy, we place a tiny little clip. Patients can't feel that, hard to see with your naked eye, but they're seen very well on imaging studies. So the lumpectomy is an outpatient procedure, and again, goal is to get the tumor out with a pad of normal breast tissue around it. That outpatient procedure, after the patient's checked in, the first place to go for the lady would be to the radiology suite. Our radiology colleagues will localize the clip for us. Now, we can't see it with our naked eye, can't feel it with our hand. Two different techniques to perform that localization. Once that's completed, the patient comes to the operating room, goes to sleep in the operating room, small incisions made in the breast, and then the surgeon, what we do is we follow the localization. So usually this is a little wire, and that's our guide so we know where to cut. And if you think of a candy apple with a stick and an apple, it's the same kind of concept where it would be a wire with a ball of breast tissue with the goal is to have the wire and the clip right smack in the middle of the specimen. And as soon as we take this piece of tissue out, we label it top, bottom, right, left, so forth, and then do an x-ray to confirm that the clip is in the middle of the specimen. And then our pathology colleagues take a look at it with us and the radiologist when the patient's asleep, and this is all done very quickly, to look and make sure that our edges look like they're clear. It can be tricky because breast tissue can look normal circumferentially all the way around the tumor, but there can be microscopic tumor there. So during the operation, we use our human eyeballs to make sure that we're wide and clear around it. And then the final pathology, which takes days, is an examination by the pathologist using a microscope to make sure that microscopically the edges are all clear. So if a lady comes back and has a final pathology result of some tumor cells seen on a microscope, that usually will mean another operation to go back to the operating room and take that section of the cavity out.
Patients actually do really well after lumpectomy. That's why it's such a nice outpatient procedure. While we're in the operating room, we typically do apply some anesthetic to the incision, and so when they wake up, they're usually not in a lot of pain. I will usually prescribe some pain medicine, and I'd say probably over half the time it never gets taken, because over-the-counter Tylenol or ibuprofen may work just fine for that. We have the patient in a bra that we actually put on them while they're in the operating room, and that applies some compression to the site. That just can reduce some complications of fluid collections that can develop after the surgery. You usually wear that bra for about a week, just day and night, except when they shower. But they can take it off to shower. The incision is glued. There's no stitches to take out of the incision, so it's very low maintenance. So they may have some discomfort for a couple days, and that's usually about it. Many people will have, I tell them they'll have a lumpectomy. No one will ever know you had surgery if you're wearing a shirt or a bathing suit. Only if you look at yourself in the mirror nakedly, you maybe see a scar. But most people, the breast is forgiving, and we're able to remove a fair amount of breast tissue without having much of a cosmetic effect. If you have a bigger tumor, then that can be more of an issue, and that may be a situation where rather than doing a lumpectomy, a mastectomy may be a better option.